That's amazing. You're so involved with mentoring our medical students here. I'm sure they're meeting with you at your office. I see them all the time in Hawkesworth in between, the lulls between staff and patients. I see them come in and I overhear sometimes some of those conversations they're having, and it takes me back to my first meeting with you. You've been very involved with the Academy with the minority mentoring program.
Yes.
You were a founding member, correct?
That's right.
What is that program, if you could just get into it in a little bit, and how has the program been doing over the past year or so?
Sure. I think there's been a understanding across medicine that there is strength in diversity. And as our society becomes more diverse, there is a need for medicine to reflect that diversity. And ophthalmology is such a wonderful specialty that I think it faces the challenge that you have alluded to, which is we're not part of the M1, M2 curriculum. And particularly if you are first generation to medicine, but particularly if you're first generation to higher education, you might get well into your third year of medical school before you even appreciate. And I've even had students who've been in their fourth year of medical school before they even recognize that ophthalmology exists. And so the MOM program is designed to find students who are entering into their M1 year, or at the latest their M2 year, and introduce them to ophthalmology. And so it's the same sort of no commitment to it. Obviously, these are students who think that they might have an interest in ophthalmology, but by definition, they're students who haven't been exposed to much ophthalmology. So it wouldn't be appropriate for us to have this firm understanding of commitment to going into ophthalmology. So the way that the program is structured is that we let medical schools know that the program exists so that they can send out information to their incoming students. We have mentors who are ophthalmologists who have expressed an interest to be mentors. And that mentor panel is quite diverse. There are certainly underrepresented minority ophthalmologists on the panel, but many of the mentors are not. They're just people who feel a commitment to wanting to have diversity in ophthalmology. And so students have the opportunity to learn about the timeline for applying in ophthalmology, what's required, what makes for an optimal application to apply in residency, options for research. Some underrepresented minority students are at programs that do not have an ophthalmology program. And so kind of building a network so that students can, if they have a summer, they can go to a program that does allow for them to do ophthalmology research and get some publications out of it that they wouldn't be able to get most likely at their home institution.
That's really nice. And I saw just a couple months ago, the Academy posted a few videos that you did in collaboration with the AUPO maybe it was just one long lecture they did and they diced it into segments, but essentially guidance as part of the minority mentoring program.
Oh, yes.
Yeah. And I honestly thought a lot of that advice was salient and great and could be applied really to medical students, across the board. Right. It was really great.